and welcome back to Voices of Dental AI. My name is Lauren King, Chief Evangelist of Trust AI. I'm here with Dr. Shankar Iyer, correct?
Perfect.
Okay. And today we are going to be talking about his legacy, everything that he's been doing to keep our profession moving forward on every continent almost that you can think of. He is one of the most well-respected thought leaders in our profession and in implantology as well. We are currently at the AAID conference here in Phoenix, Arizona. Welcome to the show, Doc.
Thank you. Thank you for having me, Lauren.
I've got some questions for you. Are you ready?
Absolutely.
Okay. Before we get into technology, I want to start with more of the human side of what we're doing.
Yes.
So you've taught in so many countries and cultures, but what have you learned about the universality of dentistry and the human experience behind it when it's talking about technology?
The past, dentistry was always associated with pain and suffering, and the way things were handled were mainly dependent on skill-based, interventions. So technology didn't play a major role because of the limited access, not being able to have the right type of training and so on. So US was considered as the leader in terms of dentistry. The first dental school was started here in Maryland. So overseas, it was lagging behind in terms of what people can do. And then maybe in the mid-50s, the concept of education spread across the globe. And the dental schools started cropping up in Asia and Europe. And that actually brought organized dentistry and created some kind of thought process that is going to address the patient's needs in a systematic manner. And it became incorporated with medicine. As you know, dentistry was never part of medicine. Lifting was very common. It was part of the barber's profession. And now it's actually a field in itself. And thanks to dentistry, we now have anesthesiology, and now most recently, implantology has revolutionized the entire profession.
I watched your lecture yesterday, and I love how in the industry, and you're challenging the profession to think, okay, yes, this is how we've always done it, but that doesn't mean it's right anymore.
Because we always, we're priding ourselves on the fact that we can remove teeth, we can get things done, get people out of pain. And there was a push towards doing more dentistry. And now we need to rethink the process. Maybe less dentistry is better. Prevention is better than cure. That's an old adage. And now when we're looking at what dentistry can do to help people smile and regain their confidence, we now are relying more on technology to help our diagnostic process get some more exposure in providing a coordinated effort to get this easily accessible to all our patients.
I think that's super important because that's what we're doing with Trust AI and Isaac is we're trying to make sure that no matter where you are in the world, everyone is getting the same standard of care in terms of education at a minimum of this is what we're going to follow. This is what we at least need to do. This is what all of the recent literature is telling us to do, or research, PubMed, whatever it is, so that even if you're in rural, middle of nowhere with no one to refer to, you have some type of technology that can help you in that moment right then and there.
Absolutely. I cannot agree more. The first time I got exposed to Trust AI, it blew me away. I would equate it almost like the way aircrafts modernize communication and travel. I think this Trust AI is the game changer for dentistry. It used to take me hours to go through PubMed, and I would take probably about a week, put all my articles together. Thanks to Trust AI, all of that can be done in a matter of seconds. And I can do a lot more in terms of getting my presentation together rather than focusing on all of the references, which is now available at the snap of a finger.
All right, let's see what else we got. You're one of the most respected voices in implant dentistry, I would say in dentistry encompassing, but where do you believe AI will make the first real irreversible impact in implantology specifically?
Implantology is actually, when you look at it as a discipline, it's mostly eloquence-based, not evidence-based. People say this is Misch's principle, this is Paulo-Maller's principle. So people are referring to concepts, not really an evidence-based approach, because technology is rapidly changing to a point, but there is no consistency. So if I want to have a 5-year follow-up on a procedure, it's very hard to get that because the companies are introducing products so rapidly, it becomes difficult to reference any sort of consistent outcome measures. So AI probably is going to help us in terms of coordinating all of the studies that are out there so that we can, before we jump into it, we have some guidelines to see if it will work or not. Prognostication is where I think it's going to make a big impact.
Okay.
We really don't know all the field sciences and so on. So when a company comes to us saying that this is a new product, try this out now. And before making an investment, if I just go to Trust AI and look at the background information, now I can approach that in a more intelligent manner rather than looking at it from a corporate view or from a perspective of finance.
Right. Which is what we are notorious for in the dental industry. It's not what does the patient need, it's what does their insurance cover. And it's like trying to pull a clinician out of that mindset and say, no, it's never about that. Your job is not to know whether the patient can afford this or not. It is, does the patient need it? Then you educate, create urgency and value behind what you're diagnosing, and the patient will either figure it out or you can help if it is actual financial issues, say to the patient, if finances are an issue, if it's a problem and I don't know about it, I can't fix it. Right?
True. Actually, we don't have performance standards, nor are there acceptable norms. So we basically do most of our dentistry because the courses and the skills that we acquire, not necessarily based on what's right for the patient. And is there a way to predict if I did it this particular way, it's going to be better? So that has not been introduced in dentistry. So having this Trust AI as our companion, as a co-pilot, is going to immensely guide our clinical practice. And I'm looking forward to having this expanded throughout my office, not just in clinical practice. Right from the time of patient walking in, AI can actually have a profiling of this patient, knowing what they're able to, what they want and what their insurance benefits are. That would be immensely helpful.
So you would agree that having a fully functioning, actually intelligent, continuous learning LLM practice management software is critical to our profession.
Absolutely. Because we are suffering right now because you're limited by what my PMS is telling me. So if I have to get some analysis as to how many of my implant patients are still waiting for the stage 2, it'll take me 3 hours for my front desk to go and pull out those numbers to be able to give me something that I can look at and say, how can we reactivate? So with this AI influence, I can probably get this much faster and reach out to them and getting them back on a recare and have them come back for continuation fee.
Right. Absolutely. I couldn't agree with you more. So when we talk about more of like a global standardization type of conversation, I know that you've trained hundreds, right, of dentists across the globe. With how inconsistent implant education is specifically and how it varies from country to country, do you see AI as a way to finally stabilize and standardize that education? Yeah, the protocols.
Yeah, it's going to take some time for AI to get to that level because it's a lot of regulatory issues involved.
Right.
In the US, we follow FDA guidelines, but the FDA is not really overseeing something that's happening in India or Philippines for that matter. So their cost is a factor. So something that is indigenously produced is going to cost 1/10 of what it costs in the US. So then if cost becomes a factor, we have no way of telling if that product is worthy of being placed in a patient's mouth. There are no regulations that requires a pre-market surveillance or a post-market surveillance. What is the testing requirements? What are the requirements from a biological characteristics? So in the absence of those types of situations, it's very hard to standardize these practices across the globe. But what can be standardized is the fact that how you approach a problem. What would be the right diagnosis for this patient? And do I need to put 2 implants or 3 implants for this patient? Is the patient better served in terms of an outcome measure, in terms of functional benefits? What about the aesthetic benefits? So is there a way I can analyze this and I can use it according to whichever country that I'm in? It'll help me decide on better treatment planning options.
Right. Okay. Actually, that makes perfect sense how you're saying that. I didn't even think about that. Wow. Okay. So in terms of continuity of care, so you follow patients for nearly 20 years and you see AI helping clinicians in different ways across the globe. But in terms of the long-term decisions, like what you were talking about in your course yesterday and how what you did 20 years ago is now work that you're maybe correcting now, or you're having to go back. So do you think that AI is going to help us not have to do that so often because it's going to see blind spots that we don't necessarily see?
Well, it will at least give us some predictor values. You can never eliminate our complications and outcomes. So maybe if I know that this product is going to probably last for about 10 years, I should let the patient know that there is a revision that is going to be necessary for this case. Dentistry is relying on a lot of mechanical factors, shoes, there are bruxers. So AI cannot predict what might happen in terms of the outcome, but at least we will be able to rely on AI to see if this modality is ideal for a bruxer, because it can give me an algorithm based upon the patient's functional requirements, their predisposing factors like smoking, diabetes. And if I can put all of this together, I can just say maybe the total expected outcome could be only 5 instead of 10. We're never going to be eliminating the complication, but at least I can get the patient to understand the limitations of what we're going to do.
Right. What do you think the barriers are in implantology, dentistry, general dentistry, surgery, whatever it is, front office, back office? What do you think the barriers are when it comes to technology implementation right now?
Yeah, so one of the biggest hurdles is education. Many of the dentists are not tech savvy. So they get afraid, many of these scanners and 3D printers are paired with the tech savvy dentists. The average dentist is afraid of spending additional time in technology because they would rather make money working on a patient's mouth rather than trying to figure out an Excel spreadsheet or trying to figure out what are the algorithms to make this work. So we rely on a lot of sourcing, and that has been working quite a bit. So when it comes to technology integration, if it's made simpler, then I think it'll be usable and it'll be widely accepted.
I agree. Patient psychology and AI. Let's dive into that a little bit. Okay. So you spent years reducing psychological barriers for patients. With AI now offering clarity through visualizations and simulations, do you think that this will increase patient trust or create new skepticism?
I think the patient trust and the fact that a third person is actually recommending it increases the value. Because when I present a treatment plan, they think I have something to sell, right? Then there's a bias. If one of my team members, they are part of my team. But if I have an independent source telling them exactly that this is what is recommended, they tend to rely on a third party who's unbiased. And that I think is a huge value, especially in the initial consult, when we have this initial discussion and we're going to have a diagnostic interpretation of all the values. And someone is telling them, well, we noticed the periodontal disease has progressed to 50%. We should get a root plane. When I say it, they don't look at it as being something that they need. But when they hear it from another person, they want it.
So it's going from real versus not real, tangible versus not tangible, urgency versus no urgency.
And we see that today in terms of just the visualization. When AI gives us interpretation of bone levels, percentage of bone levels, cavities, click a button, you can show all of the problems associated with the patient. Whereas in the past, we were just showing them grayscales, and the patient are not dentists. They cannot read an X-ray, but they see colors and they can interpret colors. And that's interesting.
I love your feedback on this. So recently I've been teaching staff of how they can integrate Isaac, just the chatbot version, because that's out right now, right? So having that pulled up in the patient room that is skeptical or doesn't think that there's any urgency around disease or that they need an implant, whatever it is, I'm telling them to pull up Isaac and show the patient how to converse with Isaac, and then tell them, I'm going to leave the room. Ask Isaac anything that you are concerned about. I have no way to manipulate what it's saying. It's only giving you facts. What do you think about that?
Oh, that's fantastic. In fact, we should send them the link. That's
so they can
get this, and when they come, they ask the right question.
Yeah, exactly.
Right? And they say whether they can test you.
Yes.
They already had this prior information, right? They are, instead of going to Google and come with half knowledge, right? This is full baked knowledge and information that they can relate to, and they can ask.
And it's correct.
Yes.
They're not coming like, well, Google told me. I'm like, oh God, this is going to be a long day.
Or Meta tells me.
My gosh.
What's going on,
It's
man?
like Meta will have you in the hospital. Sorry. You ask it too much. Because our hallucination rate, as you know, is under 0.1%,
Yeah.
which is insanity when it comes to AI, at least right now. It's lower than ChatGPT. And a lot of people, when I say that, they're like, I don't understand what that means. And I'm like, essentially think of it like this. The fact that it's pulling accurate information and it's not rapid firing too much to where then it's also giving you negative information or incorrect information. We have speed without losing accuracy, which is very, very pertinent when it comes to artificial intelligence, I feel like. Because it can look very fast. It's like, okay, great, that's impressive. But then you go back and read it and you're like, this is incorrect.
I've seen that, because before I got into the deep dive mode of Isaac,
Right.
I was testing answer this. Then we looked at ChatGPT. Then we looked at so many other platforms that are out there because everybody wants to know, how reliable it is and all. But they think it's just a ChatGPT. But the utilization and the importance of what it can present to you is amazing in terms of the reach, the precision, and the quality. And you can actually have a conversation and get into the leading answers. That would be helpful. And you saw yesterday evening, we had this demonstration and blew everybody away.
Yes. They were so zoned in and listening. Like, I think they were waiting on Isaac to slip or to trip up. And you just kept pushing and pushing and pushing. And I was even, or no, there was someone behind you and he was like, I don't know the answer to that. He's an implantologist. And you were, what were you asking that again?
It was about the RSBMT. Infused, which is a high level bone growth factor.
Okay.
And not many dentists are aware of that. Yeah, so.
Tell me, based on that dialogue that you had with Isaac last night, what impressed you the most about what it said?
It actually gave information that has been scientifically verified because I know the answer to some of it, but it was actually asking me to expand on stuff. And when I asked it, it did go into a mode where it gave all the pros and cons and gave you specific details, the risks associated with it, which I think is very impressive.
One thing I love to ask it in front of people is about, I'm very well versed in the airway sleep apnea education space. And I know that a lot of the things that we're prescribing at this time in dentistry are not root cause solutions. It's putting a Band-Aid on a broken bone. And it's not the dental professional's fault. You don't know what you don't know, and we're not being taught. But that's what educators like you and I are there for, to say, hey, did you know this? Did you know that if you give them a night guard, you're putting their airway on a skating rink?
Right.
Basically, right? Versus they're having to fight against the anatomy of their natural tooth structure. So I asked Isaac, I say, I have a patient that has grinding, they're reporting daytime sleepiness, they have a high vaulted palate. What do you think is the best possible treatment for this patient? It tells me to get a sleep study. It goes straight to the root cause. It's one of my favorite things. But just that alone, I feel like, and I'd love your opinion on this, I think that is going to help prolong the lives of our patients because we're no longer just operating from whatever school we went to or whatever dental school that's only requiring white crown now or something to graduate and not seeing patients. It's like, that's a little terrifying. But it's a little less terrifying when we now know, okay, but if they're operating with Isaac in their office, they're fine, right? Because at a baseline, they're following the latest solutions, the latest articles, the latest whatever it is that they're, trying to pull from.
Yeah, well, I think that you can even introduce this in the first year of dental school.
I think so.
Because many times when they read anatomy, they really don't understand what is it that it's supposed to do for you. We blindly memorize all of the structures, and there is no practical application to the basic sciences. So now if you put Isaac and say, when the nerve comes out of the foramen ovale and you have these divisions, what does it mean? And if I can get an answer for that, then you have a practical way to learn things that are just there as subject matter.
Okay. I'm going to be devil's advocate now because I respect your opinion. But when you're using Isaac and you're beta testing anything that we have right now, what are the things that you're trying to get it to trip up on the most and why?
Because there's an element of analysis that the humans have. in terms of, let us say, I'm going to take Tylenol and Motrin as a combination. I can titre and say, okay, this patient's brain threshold may not be that high. I'm going to probably just keep him at 400 and add another 200 of the Tylenol. So that kind of a titration, I'm not sure if Isaac is ready for that yet, to be able to customize a specific approach, which I know is practical, as opposed to, let's say, my bathing temperature could be, 97 degrees, as opposed to somebody else who was suffering from hypothermia, and they need to have some other temperature. So I'm not sure where that's going to be in terms of customizing how it should be for each patient.
Yes, 100%. I think that the more data that we have, the more that it's being used, the more it's going.
Wait,
That's the beautiful thing about it being an actual LLM versus technology with an AI sticker on it. One way I like to describe it to people, they're like, okay, what's the difference? So what? And I'm like, so what is this? So you have, let's say you have a landline phone and you have an iPhone. Okay. What's the difference? A landline phone, you plug it in, it works, it does what it was made for.
That's true.
And that's it. The only way it can do anything else is if they physically take it back, remake it, then you replug it into the wall, right? So it's an entirely different process. Now with the iPhone, and this is what Bernard calls it for dentistry, so this is the iPhone moment for dentistry. With an iPhone, you plug it in at night, you wake up, and it's been completely updated while you were sleeping, right?
Yes.
Their bugs have been fixed, problems that there
Updates.
might be updates. And that's the difference in having an LLM PMS in your office and actual continuously learning and adaptive AI versus.
I didn't think of it that way,
the
but it makes a lot of sense.
right? Yeah, you like that one, don't you? You're going to use that one, don't you?
Yes.
Yeah. Good, we got it.
Very true.
We work better together. See, you put two
Synergy,
educators
yes.
next to each other, like,
That's what happens, right?
baby that. Doc, it's been a pleasure. I love having you on here. We're definitely going to do a part. But there's too much information. We will be here all day.
Terrific.
But where can people find you if they'd like to reach out to you?
Well, I have my Instagram profile, Dr. Shankar _Iyer, or drsiyer@aol.com. That's the way to reach me.
Perfect.
And thank you for taking the time and getting me involved.
Absolutely. We're lucky to have you in our corner. All right, everybody. We will see you for the next episode. This is Voices of Dental AI. We'll see you next time.
Thank you.